we in sports are the distraction and we take that role seriously. However, in times like this, we also understand the ultimate strength and sacrifice of those on the front lines of this fight each and every day. And Heather MacLean knows both all too well. A former Olympian in 2012 in the pool and a current frontline hero as a nurse in Toronto. Heather, welcome to Tim and Sid. And from the bottom of our hearts, thank you for what you're doing right now.
Thank you. I'm happy to be here, and thanks for having me.
First off, before we get into the everyday, how are you? How are your family doing?
Both myself and my family are all healthy, and we've been enjoying this time to connect virtually. Probably we've been playing games a lot more and stuff over the computer, and so we've actually spent lots of time, maybe not physically together, but enjoying some nice family time together, and we're lucky that we're all still nice and healthy.
Good.
Heather, I ask a lot of athletes this, coaches this, just people in the sports world who are isolating, confined, whatever you want to take it. Like one of the icebreaker questions is, how are you staying sane? And now I ask you, an Olympian coming on to chat with us, how are you staying sane, especially when you're at the hospital every day and watching everything that happens? Can you turn it off? Can you? How are you going about it?
Yeah, it's hard. To be honest with you, I feel very lucky that I get to go to work and get to leave the house and kind of do have another, purpose in life right now, which is going to help at the hospital and make a difference there. And so that's been a way that I've actually been keeping sane, is I can, do what I do, and that makes me feel good and feel like I'm, adding to our community. I think what's also important for me is trying to work out as an athlete. That's our way of stress release. And so I've been trying to, stay active, doing little home workouts in our little apartment. So it's tough. It definitely is tough. But I think the biggest thing is just taking it day at a time, and know that we've got so much support from not just other athletes, but all the Canadians, and the support that frontline healthcare workers have received has really been, it's been something really special. So I think that's what also keeps us going and keeps us sane.
Like, I'm not lying, and it's Heather MacLean on with us. She is a nurse in the front lines in Toronto and an Olympian in 2012. I'm not lying when I say, I'm jaw-dropped by the strength and sacrifice that I've seen from frontline workers. But I have to ask you, what's it like to walk into work every day?
Yeah, I think especially at the beginning of the pandemic, there was a sense of, I would call it like a fog almost in the hospital. And when I really thought about it, I think it was fear from the workers, fear from patients, just a big, there's so many unknowns, right? I think now that it's been 6 or 7 weeks, we're getting into what's now the new normal, having to wear more personal protective equipment, wearing masks for the whole shift, the new policies and procedures. As I guess sad as it has become, it now is normal. And so it doesn't feel as anxiety provoking. I think the public has done such a good job of trying to flatten the curve that our hospitals really haven't been as overwhelmed as they could have been. And that's really thanks to all the fantastic work that people have done staying home and flattened our curve. And so we're kind of reaching a new sense of normal at the hospital, and one that is it's different for sure, but we found we're still trying to make jokes and have fun while we're there. And if we're going to be there, we might as well be a team and support each other while doing it. So it's coming around.
Heather MacLean joins us on Tim and Sid, an Olympian for Canada at London 2012, a swimmer there, and she is now a nurse on the front lines at Mount Sinai Hospital. Heather, I was working on a different project last night, and I was looking up the timeline of the COVID crisis. And in Toronto, what I was able to find is that the first known reported thought of a case was all the way back in late January 25th, when nobody really knew much about this. What was it like as a nurse at the hospital in the early stages when there was so much unknown, and it kind of was one after another before anybody really realized the gravity of what this thing was?
The gravity of them. Yeah, for sure. I think it was nerve-wracking because we weren't really sure what we were heading into, and even as the middle of March hit, the policies and stuff at the hospital were changing so rapidly, you really couldn't keep up, and it was nerve-wracking to know, like, are we doing what we need to do to protect ourselves? I think many frontline workers, we know this is our job and we would do it every day over and over again, but as long as we have to be protected as well. And so it was a little nerve-wracking when it when things first started to roll out, because we weren't sure how we were going to best protect ourselves, and it was scary. And I think over time, we've learned a lot more, and we have the equipment that we need. And so I guess it's become less of a scary thing. And but the unknown is scary and anxious, and it was a trying time for a lot of us, I think, but it's getting better.
We've been doing some work with Conquer COVID. Sorry, Arash. Go ahead.
I was just wondering, like, as an elite athlete, as a high performance athlete who competed in an individual sport yet was part of a team, I almost equate that with what you're doing professionally now. How much do you kind of go back to what you what you gained from your experience as a Canadian Olympic swimmer, and how much is that helping you right now, just in terms of the day-to-day dynamic?
Right. So important. And I'm thankful every day for the experiences I had on Team Canada and with Swimming Canada. And you learn in elite sport how to, work hard, dedication, working with others. And the stress of elite sport, and now I bring that to work. And in an emergency, I feel like I know how to handle my nerves. I know how to work with a team. I always say in swimming, we had a coach, a physiotherapist, a chiropractor, a nutritionist, all the different pieces of the puzzle. And it's same with work. We've got the doctors, the respiratory therapists, the anesthesiologists, everybody, all the nurses, the cleaning assistants, everybody has their own role. And I think when we work together, it reduces that stress, but also just helps bring a sense of community and a sense of team that I think is so valuable right now as we face this pandemic all together.
Heather, we've been doing some work with Conquer COVID-19, and I know you brought up the PPE. Are the levels good in the hospital right now? Because I know that early on that was an extreme concern for everybody.
Yeah, I think it's still a concern. We're not sure how much we're going to need, and it's definitely, we don't have unlimited supply. We definitely are trying to conserve what we have. We get 3 masks when we enter the hospital. We try to save multiple use of the N95 respirators as long as they don't get dirty or soiled. So we are conserving, that's for sure. We're not we don't have an unlimited supply, but I haven't run into a situation that I feel unsafe, that I haven't been able to perform what I need to do without the proper equipment.
One more from me, and I hear a lot of folks talking about opening up the province, and I talked to a couple friends who are on the front lines. I have a real close friend who's a nurse, and I can't help but think that the people that are screaming the loudest can't know anybody on the front lines. Like, what do you say to the people who are growing impatient? And I understand it, I do, and want this to be done. Like, as someone on the front lines, what can you say to someone who maybe hasn't spoken to someone in and around this every day?
Yeah, I think, we're all growing impatient. We're all getting a little bit, we want life to go back to normal. We do. But I think we really need to continue on the path we're on. This is what we set out to do, was to flatten this curve. And we've been lucky enough to, pretty much do that. And I think our hospitals really do not have the capacity. You've seen it in other cities. We do not have the capacity to treat as many patients as this virus can unfortunately affect if we do not take the time to socially distance and socially isolate. And I think knowing as a frontline healthcare worker that that possibility is out there is scary. And so it's really reassuring to know that we've done what we can, but it's not over yet. And I think, life will go back to normal, and we want life to go back to normal just as much as the next person, I can promise you. But to keep everyone safe and to keep us safe, we got to keep doing this for a little bit longer.
Well, I hope you can feel it from the general public and from guys like Arash and I, but we are Team Canada. I know the COC has been pushing the idea on Twitter and the thought process, but we appreciate you guys. We hope that they include vacations whenever the reopening plan starts for the folks in the front lines, because you guys deserve so much for what you've been able to do. And I hope that the folks around you know how much we all appreciate your strength and sacrifice. Thanks for doing this, and thanks for doing it every day.
Oh, thanks so much. I appreciate it, and it means a lot. And thanks for your support.
Of course. There is Heather MacLean, a nurse and an Olympian.